Hi, this is Jessica Dwasa at the Guidewell Innovation Lounge here at Exponential Medicine, and I have our guest here. This is Tippi MacKenzie. She is an associate professor for surgery at the University of California in San Francisco. So welcome, Tippi. Thank you for joining us here today.
Thank you, Jessica.
Thank you. So I understand that you've been doing a lot of research yourself in one of these exponential technologies, and I'm just going to jump right in and ask. So we read that you are doing research where you are modifying stem cells on fetuses in utero. So talk to me a little bit about this, because this is just mind-blowing.
Thank you. I'd love to. It's my favorite topic to talk
Perfect.
about. I've been doing research for more than a decade in the field of fetal stem cell transplantation, where you have the opportunity to transplant stem cells into a fetus with a birth defect to cure that defect before the fetus is born.
That's incredible.
So you can imagine this would be a good treatment for blood disorders, things like sickle cell disease or
Right.
thalassemias, where the disease is quite severe and the severity of the bone marrow transplant also adds to the burden.
Right. So how far along are you in developing this? Like, is this something that you're researching? Is this going to hit the market soon? Where are we? Where are you?
So we're along the pathway. So we've done a lot of work in animal models, and we've shown that the best kind of stem cells to transplant into the fetuses actually come from the mother.
Oh.
So because the fetus and the mother tolerate each other during pregnancy, and so if you put in stem cells from the mother, the fetus doesn't reject those cells. Whereas if you put in any other kinds of cells, then actually the mother comes in and rejects those cells in the fetus. So we've shown this in animal models. Our colleagues also around the world have shown them in animal models. And we've recently applied to the FDA for permission to do a phase 1 trial in a disease called alpha thalassemia.
Okay. So I want to ask, I mean, obviously you're experimenting every day in these exponential technologies, and you're on the pathway to developing a solution perhaps that can be distributed broad scale, right? So it's like, what kind of frustrations are you encountering, or what kind of challenges do you have as you're trying to innovate in this space? And the pace is obviously maybe not as fast as you want it to go. What are some of the challenges that you're encountering?
Yeah, I think the main challenge is just the recognition, or the lack of recognition, that many of these technologies that are being developed can be applied to the fetal environment and can be applied to pregnancy.
Ah, okay.
So, all the omics technologies that are being developed could potentially be applied to the world of prenatal diagnosis in being able to develop ability to improve the prognosis of patients with birth defects, for example.
Okay.
So we're really trying to bring that.
What of the exponential technologies here has you most excited in terms of integrating it in for either care for the fetus or care for the mother?
It's mainly the omics technology.
Really? Okay.
The ability to do ultra-fast sequencing of DNA, RNA, cell-free RNA, all the proteomics approaches, and really applying those to the fetal environment to predict when a fetus is going to get sick, rather than act reactively after the fetus is already sick.
Okay. And generally speaking, as some of these technologies, either the ones that you're working with right now or some of the others that we're hearing about, artificial intelligence or robotics, things like that, as a practitioner of medicine, is there any way that you feel technology is letting you down, that they can do better in terms of making solutions that fit better?
I think, in my world, in the fetal world, it would be wonderful to have some solutions that are more miniaturized so that we can apply them to the fetal world.
Sure.
The market share for birth defects is small. So how do we break the barrier of developing things where the market share is going to be, fairly small?
Okay. And now I want to ask also, I read too that you are a strong proponent of engaging women, particularly girls, in developing careers in science or in medicine. So tell me a little bit about that.
I think it's very important to be a role model for girls and young women in going into science. In addition to being a scientist, I'm a surgeon, so definitely, working in a male-dominated world. And it makes a big difference to have a female mentor or female role model as you're trying to imagine yourself being a leader in those worlds. So I try to mentor students in my lab. I'm on the board of the San Francisco Girls Chorus.
Oh,
and trying to, to live my life according to those principles.
Wonderful, thank you. So last question for you. I want to know, we're at this conference where, obviously it's exponential medicine and we're talking about the future of healthcare. What are you most optimistic about in terms of the future of healthcare?
I think all these technologies are going to improve our ability to be good doctors. And the favorite part of my job is just being a doctor. You know, it's an amazing privilege to be able to treat patients, to be able to look a patient in the eye and say, I know what's going on and we can fix that. And to be able to use these technologies to do that in a more accurate, more effective way is an incredible privilege that's going to arise from this.
Wonderful. Dr. MacKenzie, thank you so much for joining us here in the Insights Lounge. We appreciate all of the work that you're doing. It's absolutely transformational, and we hope to see that sped to market as quickly as it can go.
Thank you so much.
Thank you for joining us.
Thank you.
I'm Jessica DeMassa in the Guidewell Insights Lounge here at Exponential Medicine.